Hi, everybody. So today we're going to start the spinal cord injury lecture. I've divided it into two parts. So this week is part A, and then next week we will cover, we'll focus on the treatment. So this first part constitutes more than half of the eval, more than half of the lecture information. So when we think about spinal cord injury, it's a low incidence injury, but very high cost disability. They estimate for a patient with a high cervical injury, C1 to C4, a high cervical level injury, that first year post-injury costs about $417,000 for care. So, it's a really expensive injury, high need, high nursing care, a lot of therapy costs, equipment costs. So it's a heavy hitter as far as costs go. They estimate about 17,730 new cases per year. And currently we have about 291,000 people living with spinal cord injury in the United States right now. So about 78% of people who suffer a spinal cord injury are male. There's a 4-to-1 male to female ratio. So for every 4 men who suffer a spinal cord injury, there's 1 female patient. So, that's related to high impact, high risk behavior that often causes that spinal cord injury. The average age range for folks who suffer a spinal cord injury, it's most likely to occur between 16 and 30 years of age. The average age at the time of injury is about 43 years old. The time of injury, a large majority of these folks suffer injuries during the summer. That's when we are, riding motorcycles and swimming and diving and a lot of outdoor parties, those types of things, and weekends. So summers and weekends. I used to work at Boston Medical Center on their spinal cord injury specialty unit, and we would call, that summertime from like Memorial Day to Labor Day was, like the spinal cord season. That's when we would have huge numbers of patients. That's not to say spinal cord injuries don't happen year round, but there was always generally a big increase during those summer months. When you take a look at the things that actually cause spinal cord injury, motor vehicle accidents, that would include cars and motorcycles, account for about 39% of spinal cord injuries. Falls account for 32%. Violent acts account for 13%. Sports-related injuries account for 8%. And medical surgical complications, I think that should be at 4%. So the life expectancy for these patients continues to increase over time as our medical care continues to improve. So we see folks living longer with spinal cord injuries. As we spend, more money on research, you have foundations like the Christopher Reeves Foundation, who puts a lot of money into research, and we better understand care, the science behind, the secondary complications and those types of things. The causes of death for these folks, the primary causes of death would be pneumonia, major respiratory issue, pulmonary embolism or PE, as well as septicemia, the body-wide infections. Okay. I'm going to stop it there if I can figure out how to do that. The cursor is missing.